Hello, I'm Herb Silver, and this is the Breathing is the Key lecture series. And today I thought I'd give an introduction to some of the cool technology, some of which we're familiar with, all of us, like blood pressure cuffs, um, heart rate monitors, pulse oximeters. All these things we're going to be using and how we're going to be using them to have a modern, new understanding of how we can use breathing to treat many of our patients, clients with chronic pain, uh, breathing problems, certainly brain fog, chronic fibromyalgia. We're going to go and how we're going to use these tools to measure their response to treatment. So the first tool is a pulse oximeter. When we're doing breathing things, of course, what we know is when our clients come into the clinic and we're screening them for COVID, most everyone has, I hope, normal O2 levels. And what you'll find is that oxygen levels in the blood aren't the problem. We've got lots of oxygen. People are fully oxygenated. We know that athletes, if they want to get more oxygen into the blood, they go to high altitudes and do high altitude training, or they just suck out platelets, and before they're going to perform, they do blood doping. Well, we're going to talk about how you can use breathing to affect those very things, but also how you can affect getting the red blood cell off the red blood cell, how to get oxygen off the red blood cell and into the muscle where trigger points are hypoxic and into the brain. So, like I said, we got blood pressure cuffs, we have pulse oximeters. We're going to also use with heart rate monitors. We can measure heart rate variability, which gives us a direct measure of the autonomic nervous system. This blue line, it's backwards because of the camera, but the blue line gives my function today of my parasympathetic nervous system compared to the yellow line, which is my sympathetic nervous system. And this is altered by correct breathing. A lot of the breathing techniques we use aren't so correct. And what we're doing is we're ending up becoming hypoxic by breathing off too much carbon dioxide and not getting oxygen into our brain. So we're going to learn how to measure that. We can reduce blood pressure with proper breathing as well. The way we measure, the direct measure of carbon dioxide in the blood, nifty tool here, a capnograph, which we use a nasal cannula. We measured exhale CO2, and that's giving us a direct measure of CO2 in the blood. And we're going to go over in our first lecture, we're going to go over how we're using this to get an ideal level of carbon dioxide in the blood to enhance getting oxygen off the blood into the brain, into the muscle. So these are our nifty tools, and I wanted to let you know that's how we're going to do it as far as technology goes. So thank you very much, and look forward to talking to you in our future Breathing is the Key series.